I'd like to shift gears now to Dr. to Dr. Kolditz and Dr. Cohen, talking about lifestyle factors. We know that they have a major impact on cancer risk, and some experts say 70 to 90% of all cancers can be prevented by applying what we know right now, including nutrition, exercise, stress management, and social connections, as well as environmental exposures. So let's talk about diet first. What foods do you recommend for reducing the risk of cancer, heart disease, diabetes, as well as increasing our overall sense of health and well-being? Dr. Kolditz.
Great question. Just as David said, you can't stop breathing to avoid air pollution. You've got to eat and exercise to remain healthy and alive. So I largely follow a theme of maximizing fruits, vegetables, and whole grains, limiting red meat, limiting alcohol, and a real focus on variety in the fruits and vegetables. Certainly, like others, we've recommended avoiding sugar-sweetened beverages, replacing them with water and beverages that are not sweetened, and all of that with physical activity goes to avoiding weight gain, and obesity is one of the modifiers of the environment inside our body. So we're really looking at this as air moves into your lungs and drives lung cancer. The long-term equilibrium of our eating modifies the environment inside us. You might add?
Thank you. Dr. Cohen.
Sure, I'll expand on this and highlight, I guess, some of the epidemiological evidence that exists that allows us to compare countries and the incidence of different cancers in different countries. So if we look to the East, in particular to China, and the incidence, for example, of breast cancer in China 20 years ago was extremely low, and in particular in rural populations. And now the #1 cancer in Beijing, Guangzhou, and Shanghai for women is breast cancer. And this is because of tracking a number of different changes, one of them being the dietary changes, moving from their rural diet, which was, as you just heard, primarily a plant-based diet, not to the exclusion of animal products, but that the animal products made up a minority of the calories that individuals were consuming, and that they were eating whole foods, meaning that they weren't processed or minimally processed. And that, of course, is the exact opposite of the standard American diet. I think that the reduction of sugar is something that needs to be emphasized. We published a paper at the beginning of this year that was done in animals, but it is reinforced with the epidemiological studies showing that people who have a higher calories from sugar in their diet, and this is primarily with added sugars, have a higher incidence of cardiovascular disease, cancer, as well as Alzheimer's and dementia. So a commonality, and of course diabetes, a commonality actually of all these diseases is that they are inflammatory diseases, meaning that we have heightened activation of parts of our system, in particular aspects of our immune system. And we documented in this research that excessive sugar exposure causes inflammation in the system. And so this is something that luckily the USDA has stepped forward and has dietary guidelines saying we should consume no more than 10% of our daily calories from added sugars. We also need to control our overall glycemic load. So that is controlling the amount of insulin spikes that we have in our diet, and processed foods, and in particular the white foods, so white rice, white flour, and of course sugar itself, will lead to spikes in glucose, which will lead to spikes in insulin, and insulin will lead to inflammation, excess insulin exposure. And of course, we know that's a risk factor for diabetes. It's also a risk factor for heart disease and cancer. So primarily whole foods, plant-based diet, and foods that help to keep our glucose levels from having these sharp spikes. So think about the Mediterranean diet, think about the traditional Asian diet, and moving away from the standard American diet, what is called the SAD diet.